Hi, and thanks everyone for joining us for today's webinar, which is called What Do I Do If? COVID-19 Best Practices for Essential Businesses. Today it's presented by the Region of Waterloo Public Health. My name is Allison Mitchell and I'm part of the Greater Kitchener-Waterloo Chamber of Commerce team. Before we start our webinar, there are a few housekeeping items that I'd like to share. Your microphones should be muted at this point, but if you could please double check in order to reduce background noise, that would be appreciated. Please feel free to ask questions throughout the webinar by typing into the question box in your control panel. Our presenter will be answering the questions at the end of the webinar. And for everybody who's registered for today's webinar, there will be a follow-up email that you'll receive with a recording of today's webinar. Our presenter for today is Sandy Stevens. Sandy is the Director, Health Protection and Investigation with the Region of Waterloo Public Health and Emergency Services. In today's webinar, Sandy will be providing us with COVID-19 best practices for essential businesses, as well as answering your questions. I will pass it over to Sandy now to begin her presentation.
Thanks so much, Allison. I appreciate that. Welcome everybody. Thank you very much for taking the time to attend this webinar today. By way of introduction, I just want to let you know a little bit about my background. I'm a public health inspector by training, and I currently, as the Director of Health Protection and Investigation for Regional Waterloo Public Health, oversee a team of 27 public health inspectors who routinely inspect certain types of businesses throughout the region. Primarily that could be food premises, but there's also others that we inspect, such as recreational swimming pools, personal service settings, things like hair salons, tattoo parlors, that sort of thing, as well as do a host of environmental health work. And those inspections are to ensure that they're in compliance with a variety of provincial regulations. So we're actually provincial offences officers as well. Our training as public health inspectors is specialized and it's focused on environmental health, which is roughly described as where illnesses in the environment come into contact with people, so how the two intersect, and then how to mitigate the risk to people from these diseases. So our main focus really, as is all public health, is looking at the health of the population as a whole and keeping them safe from a variety of communicable or even chronic diseases, but our specialty as public health inspectors is the communicable diseases, the ones that you can catch from others or from the environment. So today we are looking at coronavirus, obviously, and I'll give you a bit of a background as to what it is, hopefully a little bit more in depth than some of what you've been hearing, in the news, but also sort of looking at it through the lens of proactive steps that businesses could take. As part of that, we've, over the course of weeks, had a few questions coming in to us from a variety of businesses. So I'll attempt to answer a couple of those. And then, as Allison mentioned, there's an opportunity for you to answer questions as well at the end of this, or sort of to ask questions at the end of this. I'll just point out, though, that my work as a health inspector generally only brings myself or my team into contact with a limited range of businesses. And I recognize that there's probably a whole host of types of businesses represented by the people on this call today that I'm not familiar with. So I'll do my best to answer questions regarding coronavirus in the workplace, but I do ask your understanding and forgiveness if I'm not able to really give detailed responses about specific types of workplaces, mainly because I don't have that level of familiarity, and there's so many times when the answer really is, it depends, but I'll do what I can. So moving on, as you're well aware, coronavirus is it's a family of viruses, actually, coronaviruses. So the 2019 novel coronavirus, which is what we're talking about, everybody's talking about right now, is just one of those. So that part of it, that family, is not especially new or novel. What's novel is that this is a new sort of member of that family that was just discovered really at the end of December, which is why it's 19 and was still actually named in 2019. I think it was December 31st, if I'm not mistaken. And coronaviruses are a large family of viruses that can cause all sorts of illnesses, but they're respiratory infections. So they can be responsible for a common cold, They can also be responsible for SARS. There's something else that's known as MERS-CoV that you may have recalled hearing about a couple of years ago that came out of the Middle East. It's the Middle East Respiratory Syndrome. So these are various types of coronaviruses, but structurally and sort of the family, they're structured similarly to a cold virus, really. COVID-19 is actually the name of the disease that is caused by the 2019 novel coronavirus. So it's just the distinction between the virus itself and the disease it causes. So the virus is spread mainly from person to person through close contact, for example, it's spread in a manner that's very similar to colds or the flu, but it does cause more severe symptoms. It's also much more transmissible, so it's much more easily caught by another person than, say, a cold would be, but it's really spread in the same way, and that spread is done through primarily through respiratory droplets, which I'll get into a little bit in a second. And you know, for those droplets to actually infect somebody else, it's got to be through a little more close or prolonged personal contact. So passing somebody on the street isn't going to do it. You've got to actually sort of be in their space, you know, in their personal space for a while, such as when you live in a household. You can also pick it up through touching things and then transferring the virus to your mouth, nose, or eyes before washing your hands. So those are all mucous membranes, and they're much more absorbent. So it gives the virus a mechanism for getting into your system by going through a mucous membrane, such as found in your mouth, nose, or eyes, rather than, say, just on your hands. So it's that transferal that's the key there, which is why washing the hands is always, you know, always part of the recommendations for managing this. Now, there's when it's being spread, it can be spread a couple of ways, and one is referred to as pre-symptomatic transmission. And what we're finding now, and because this is a new virus and we're still learning lots of things about it, not everything is known about it yet, and things continue to come to light. But recent studies are showing that pre-symptomatic transmission is possible. So it means that somebody is able to transmit the virus out of their system and pass it along to somebody else before they actually have symptoms, so they don't know that they're sick yet. And we see this with the flu as well. The influenza will have normally about maybe a 24-hour period that somebody is capable of making others ill with influenza before they know they've got the flu themselves, before they actually start to feel unwell. Asymptomatic transmission is slightly different, and that's where people are able to infect others. They're shedding the virus and they're spreading it, but they never actually develop symptoms themselves. So all along they feel well, and they don't have anything that gives them any indication that they're unwell or carrying the virus. And that's significant because quite often, you know, you've probably experienced it yourself. If you have a cold or the flu or, you know, anything else that's making you feel unwell, you naturally want to self-isolate. You know, the first thing you want to do really is kind of not go out of the house. You stay in bed, you lay on the couch. You don't want to see people. You're not going to be going out to parties because you don't have the energy. You don't feel well enough to do that. For people that are either pre-symptomatic or asymptomatic but capable of spreading the virus, they're not going to do that because they don't feel unwell. They just go about their business, not knowing that they've got this virus in their system and are capable of spreading it. However, I will say that the primary driver of the virus, of the pandemic for COVID-19 has been individuals with noticeable symptoms. So although we know that pre-symptomatic and asymptomatic transmission can happen, it's still not believed to be the main mechanism by which this is spreading. It is still being spread by people that are actually having symptoms and still engaging with other people and spreading the virus that way. And generally, it's those that are in close contact or close physical settings with others. Of the people that do get COVID-19, about 1 out of every 6 of those will become seriously ill. And usually the seriousness of that is the difficulty breathing. Most likely, the people that are going to be impacted this seriously will be older people or those with underlying medical conditions, such as high blood pressure, heart problems, or diabetes. So, really the best way of limiting the spread of the disease is everything that you've been hearing, right? Staying home as much as possible, physical distancing, washing your hands, and essentially trying to reduce the likelihood of somebody else being exposed to the virus and becoming ill from it, or yourself being exposed to it by interacting with a lot of other people. So the image that you should be seeing on your screen now is just kind of a graphic of how the virus is actually transmitted. So that's just sort of a freeze frame of a sneeze, essentially. So you can see those droplet particles, coming out from the individual's mouth. And we've all seen it. We all live in Canada. You know what it's like when you see your breath in the winter. That's the moisture droplets that are coming out of your respiratory system. So they come out when you breathe, sneeze, or cough. And what happens is the virus actually attaches to that moisture droplet. And now the good thing is that it is attaching to this droplet, and that droplet has some weight to it. So what happens is that even though it's being projected out of your mouth when you speak or sneeze, because of that weight and because of gravity, it will drop to the ground. So there's sort of a recognized distance that that droplet will travel before it drops down to the ground and then become harmless. And that's where we get that 6-foot radius from. So that's where that piece of advice is coming from. It's it's kind of, it's the estimate of, I would say it's not that we expect that the droplet's going to travel 6 feet. I would expect that it's actually traveling less than that. I know when I was in school, I was always told about arm's distance, that whole, get out of my space feel, that distance of your arm's length is probably about the distance that it's really going to travel under normal sort of speaking circumstances. 6 feet gives you a buffer. It gives you a buffer from the other person as well as yourself. And should you be coughing or sneezing, again, you've got that additional distance there. So that's where that 2 meter, 6-foot radius really comes from. And then, of course, you also want to avoid getting in close with other people for hugs and handshakes right now, which is sad, but possibly part of our new reality. So the whole physical distancing piece is about not getting close enough to others to spread the virus to them, or for them to spread the virus to you in case you have it, but you're not showing symptoms and you're not aware that you've got it. It doesn't mean you have to be a prisoner in your house. You can go out for walks, get some exercise, go into your yard, onto balconies, but you just don't want to be mingling with people. And I would anticipate that probably as things start to loosen up, those will be kind of the situations and scenarios that we'll see loosening up first, where you can get outside a little more and interact somewhat, but it's still being able to keep people at a rather safe distance until we see how things progress. So in terms of sort of protecting a business from the risks of coronavirus, there's a number of things that you can do. And again, I don't think any of this is going to be truly new to you, but it just might provide a little bit more, hopefully a little more insight or answer some of the whys for you. And again, if you've got questions at the end, I can try to address those. But so the first 2 points on here, screening staff and disinfecting surfaces, I'll speak to those in a little more detail in a future slide. But other things that can be done, really that are the high impact things for reducing the viral load in the environment and amongst people are again all the things that we've been hearing all along. So hand washing is always key. So again, getting back to, if you are touching things that might have virus on it that's still viable, you don't want to pick it up and move it into your mouth or your eyes. So the ability to wash your hands, particularly before eating, is key. As an inspector, this is something that we were always looking at in restaurants anyway, and making sure that they had adequate hand washing facilities, because it's the key for preventing the spread of numerous diseases, not just COVID, but so many other things. And some of the things that we look for routinely would be, one, to make sure that there's hot water available. I can't count the number of restaurants I've been to where the hot water tank has been shut off to the bathrooms, and nobody is going to wash their hands thoroughly and for the length of time that's necessary to do a really good job if the water is cold and it makes it painful. So please make sure that there's hot water available in the workplace for people to be able to wash their hands, because if it's uncomfortable, they won't do it, it won't be effective, and you won't protect your staff or yourself. Paper towels are another key for this. No reusable towels in washrooms, shared washrooms. What can happen is people may think they're washing their hands well, and we've all seen it, people that sort of just run their fingers under the tap and call it a day. And then if they're drying them off on a reusable towel, say in the workplace, everything that's on their hands that didn't just get washed off, which wouldn't be much, is now on that towel. Right. So, and we're not just talking COVID, but again, because I'm a health inspector and we spend a lot of days making sure that poop doesn't get into food, that could be fecal matter from people using toilets, and then they're not washing their hands thoroughly. They're wiping it off onto a towel. Somebody else comes along and does wash their hands thoroughly, but has to use a dirty towel, and then they pick up bacteria or virus from that towel, and they just recontaminate themselves. So paper towels are best. I know they're not the most environmentally friendly these days, but I think in light of concerns about moving moisture droplets around with the virus particles, hot air dryers, although they're good, they're very effective for drying hands, are probably a second choice right now for a mechanism for hand drying in washrooms. But if that's all you've got, that's what you've got. I wouldn't be disabling that, like if that's what you've got. But if you're able to put in paper towels, that would probably be helpful. Another thing that would be useful is to sort of get staff, anybody that comes into your workplace, comfortable with the idea that once they've, when they're coming into your workplace, they're bringing in all the germs that they've just encountered, especially if they were on transit or they stopped off somewhere and picked up something or other. So have them wash their hands when they come in. It's probably a good principle to have in your home. I do this all the time, have done for years. I don't know if that's why I tend not to get a lot of illnesses, but it's just been a practice that was drilled into me. The minute I walk into the house, I wash my hands, and then at least I know whatever I tracked in from the great outdoors or from the grocery store or wherever stopped at the kitchen sink where I washed my hands. So it wouldn't be a bad practice to have to recommend for employees as well. You can set up a garbage can in the washroom as well, so that it's near the door. So that way, if they are using paper towels, the way of doing it to open a door is to use the paper towel that you've just dried your hands on to open the door, and then you throw it away into the garbage can. So similarly to the towel that is being reused, if somebody didn't wash their hands properly and now they're handling the doorknob, the door handle in the bathroom, they're also depositing things on that. And then somebody who has washed their hands well will pick it up from that high touch surface and have just undone all the hand washing that they just did. So if you can have a trash can near the door in the bathroom, encourage people to open the door with a paper towel, and then they throw the paper towel away as they're walking out the door. That saves them from touching that likely highly contaminated high touch surface. Hand sanitizer is another good option if hand washing is not available or it's not practical. You can't always be running to the sink every 5 minutes to wash your hands. So hand sanitizers do work, and we do support their use in a variety of settings. They're very popular in healthcare settings as well. They are effective. What they are good at is cleaning hands that are not visibly dirty. So if there is visible dirt or grease on your hands, what that will do is actually form a protective coating around any bacteria or viruses that's on your hand and not allow the hand sanitizer to come in contact with it and kill the bacteria or viruses. So it's only good for hands that are not visibly dirty. So for example, when we're inspecting kitchens, we would not say that the food handlers could use a hand sanitizer in lieu of washing their hands, because they're likely to have, say like, chicken grease or meat fats on their hands. It's not going to be effective, and then they're just going to transfer it to other surfaces. But if somebody, again, is just coming from outside, or they've just been using, handling money or something, or their cell phone, then a hand sanitizer is perfectly fine for that. Read the labels on the ones, if you're buying anything. Look for a minimum of 60% alcohol content. Anything less than that is probably not going to be effective. It's mostly water, and it won't really have enough alcohol to do the job. Hand washing itself or hand hygiene with a hand sanitizer can be tough on hands, especially if you're doing it frequently, as we're all encouraged to do now. So do purchase good quality soaps or hand sanitizers, nothing from the dollar store. Get something that's got some emollients in it, so it does kind of reduce the drying that can happen. Because what can happen is your hands will actually start to crack and become infected with other pathogens. This is something we see a lot in hospitals, for example. Nurses have to be very careful about looking after the skin on their hands because they're cleaning their hands so often that they don't want it to then become a vehicle for trapping other bacteria into cuts and chapped skin. So, and we'll throw this last piece out there about sort of your business and staff. My disclaimer is that this is not a formal public health recommendation, but it's just an observation I've made over the years, particularly inspecting food premises, where we're trying to encourage staff to stay home if they're not well. And that is if the staff don't get paid for sick time, then there can be an incentive for them to lie, to pass any screening and continue to come to work because they can't afford to be off. So, certainly beyond my scope to tell anybody how to set up their business that way, but it is just something I think to keep in mind, certainly in these times that, we need to support people to be able to stay home and get themselves healthy and not bring it back into the work environment. And I do believe that should somebody be required to self-isolate, whether it is at the direction of public health or not, I think they are now eligible for some of the employment benefits or the benefits in CERB from the federal government to alleviate this very concern. So in terms of interacting with customers, again, we've probably all seen this, and for those of you that are operating retail businesses, you're probably already well on the way to this, but again, it just sort of builds on those similar principles that you're trying to create the space between people and maintain that space. So in terms of the number of customers that you may have coming into your store, look at your the area of retail floor space that you have, and then do some calculations. One person per 4 square meters, which gives you that 2 meter by 2 meter buffer, gives you a rough guideline. Now, obviously, not everybody's going to be staying in their little boxes as they move through the store, but it does give you a bit of an idea of the capacity and the occupancy level that you want to target for customers in your store. For people waiting outside, having some sort of a visual marker outside certainly helps. Because you forget, right? I do that myself. Occasionally when I go out, when I finally leave my home office, I completely forget that I need to be standing, 2 meters away from somebody, unless there's that visual cue there. As well, about having phone and online payment options rather than handling cash whenever possible, and having markers placed on the floor, checkout aisles. I think one of the key things to this may be, though, for staff to sort of feel empowered that it is okay for them to monitor customers in the store or in the lineups and remind them to move apart if necessary. So again, if that natural clustering is starting to happen because people are just sort of not aware or they're distracted by something else, it's okay for the staff to remind them that, hey, you're getting a little bit close to the others. Do you want to maybe back up a little bit, please? I think the customers would probably, hopefully, mostly appreciate that. But I know I certainly would, because unthinkingly, I will, still move closer to other people because that's what we do. We're social beings. So I think the staff being the eyes and ears for that is a significant sort of help for ensuring that physical distancing continues. Now, I mentioned screening employees a little bit earlier. So this, again, is, I think, one of the keys for ensuring that your workplace stays healthy. It's not foolproof, but it is definitely a significant step that can be taken in every workplace. And that's essentially to screen staff daily. for symptoms. Are they getting unwell? And the screening can take a couple of different forms. The staff could just be encouraged to do it themselves. It could just be sort of a self-monitoring check-in, like, hey, do I, what's that scratch in my throat, or how, why am I feeling a little more tired right now? Is it unusual, or can I explain it? Do I have a headache? Is it, is it tension, or is it unusual for me? Or they could do, there's a self-assessment tool. The link is on the slide there. There's a couple of them out there. Essentially, it's drafted by Health Canada, but this is the Ontario version of it, where it walks an individual who takes that assessment through a series of questions about their health status. Do they have any of these symptoms? And depending on where they land with the symptoms, they may get a number of different suggestions at the end of it. One of it could be, yeah, you're perfectly healthy, you're good to go, have a great day. Or it could be, you know what, you've got a couple of things there that maybe need to get checked out. How about you give telehealth a call? And then you can have a conversation with telehealth and run your symptoms by them. Or maybe, you know what, you checked off a whole bunch of real red flags for COVID. Maybe you need to go see a healthcare provider now, or get yourself to ER if you're having trouble breathing. So there's a variety of ways of doing it. Certainly in long-term care retirement homes, which you're hearing a lot about in the news right now, and my team is heavily involved in monitoring the health and their infection control in those homes as well. This screening tool it's called active screening that's happening in those homes, and that's one of the key mechanisms for trying to keep COVID out of the homes. Nobody enters one of those homes without actually having to have a conversation with somebody at a desk and running through a list of symptoms. And I believe now they're getting their temperature taken as well. So they've got those infrared thermometers, and you see the photos on the news to make sure that nobody's coming in that's got a fever or a cough or any of these key symptoms for this. So I'm not necessarily suggesting you have to set that up in every place. If you're big enough that you've got OC Health support, then that may be something that they want to consider. Or at least having a screening tool, maybe posters at the door reminding staff that before you come any further, check, sort of do that self-check. And of course, if anybody does have those symptoms, they're to go home, right? You don't want them coming into the workplace with any of those symptoms. So most of the symptoms are mild, and they do begin gradually. And as I mentioned, some people can become infected but don't develop any symptoms at all. And most people will recover from this disease without needing any special treatment. So again, it's those with the underlying health issues that may have more significant impact. So if an employee is sick, as I mentioned, you want, if they're doing the self-screening before they get into work, then just tell them to stay home. If they arrive at work or they feel unwell at work, start to feel unwell at work, you really want to separate them from others as soon as possible and send them home. If the symptoms get bad enough, they should be contacting a healthcare provider. Especially if they're having any trouble breathing, that's not something you want to try to tough it out. You really do want to get some help for that as soon as possible. If at all possible, I don't know if people are still asking for these, but we do hear from time to time, don't ask for a note. The healthcare system, doctors are overwhelmed enough as it is. This was an issue long before COVID came up, but requiring a doctor's note isn't necessarily going to help, and you don't want to be sending somebody with COVID who's got mild symptoms into a doctor's office to get a note unnecessarily. Not everybody who does have symptoms that are similar to COVID will have COVID. It could be a cold, it could be the flu, but just the same, it's not something you want circulating in the workplace. If somebody does have any of those symptoms and screens in that way, you do want them to self-isolate at home for 14 days from the date that they develop the symptoms. Generally, they can stop isolating at home after 14 days if they don't have a fever and the symptoms are improving. If they're continuing to be ill, they may still have it and they may still be able to transmit it. And that's the main reason for them being home, so that they're not able to transmit it to others. So this is a question that we get asked a number of times, which is, as an employer, do I have to notify my employees if somebody on staff tests positive? And the answer is you've got to be aware of privacy rights. So The short answer is no, because you cannot disclose personal health information unless your employee has given you explicit permission to do so. And this also goes back to taking that proactive approach, knowing that there are people capable of spreading the virus that don't have symptoms and may never have symptoms. There isn't really anything you should be doing differently if somebody is diagnosed with COVID that you aren't doing already, because there could be, you could know that one person has just been diagnosed with COVID and they're clearly symptomatic and you know that they've got it. But what you may not know is that there's 5 other people in the workplace that are still shedding the virus and don't have any sign of a symptom. They're the ones that you need to worry about. So if you have all your precautions in place at all times, then you're protecting everybody against those that are asymptomatic or pre-symptomatic, not just those that you know about. I think there's a psychological comfort level that you know of somebody, a specific case, but really, the bigger picture is that anybody can be shedding this at any time, and knowing or not knowing doesn't really make any difference. Public health will advise cases if we become aware of them to let their employer know. However, not everybody's going to want to do that. And public health, when we do case follow-up, will not normally contact employers directly. And even if we did, we could only do it if we had the express permission of the person who is ill. We would never disclose health information to a stranger without having that permission. There's a number of pieces of legislation that address that, and we get monitored on that very closely. So it's core to what we do that we don't disclose health information to anybody, even within family units, unless it's a minor that's a child and we're dealing with the parent. So what you may find is that you've got somebody who tells you that they need to stay home, and my advice would be don't doubt them, just support them as best you can. So, because we in public health also, there's limitations on who is actually getting tested. So there are likely, there's bound to be many cases out there that we're not aware of, because the testing right now is still so narrowly focused, primarily on healthcare providers, people in long-term care homes, or close contacts of people with a confirmed case. So it's quite possible that you could have people ill in the workplace with COVID, and you would never get a positive confirmation anyway, nor would they, unless they went for testing. And not everybody's being referred to testing unless they belong to specific groups. I will also comment that something my team gets asked occasionally is to review policies in the workplace in advance regarding the management of COVID or other infectious diseases. And it's not something that we don't do. It's for a variety of reasons. It's really impossible for us to do that, as we don't know the intricacies of all the workplaces, nor do we have the capacity to do so. So if, for example, we did find out that there was an outbreak in a workplace, which again is not our usual sphere of operation, so it would only be exceptional circumstances where we might become aware of one. We might ask to see policies then, just to see if there's any gaps and provide suggestions on how to reduce those gaps. But really, this is where occupational health and safety advisors would come in, and they'd be able to review those policies for you. So in terms of cleaning, this is also something we get asked a lot of, and this is something I could probably talk on for hours because of the nature of the work that we do. But there are a few steps to pay attention to if you're going to be doing any cleaning in the environment in the workplace, and certainly I recommend that you do that, and do it probably far more than you were doing it historically, unless you're a hospital or a HACCP plant or something like that. But the coronavirus is structured similarly to the cold virus. So it can be killed just as easily as the cold virus. So if you sort of think in terms of that's what you're trying to kill for and to clean for, then you don't need to go into any extraordinary lengths in most workplaces. What you are looking for, though, is there's essentially two steps. There's cleaning and there's sanitizing. So cleaning is sort of that removal of dirt and grease buildup, just kind of washing things. Soap and water is fine for that. There are a number of products on the market that will clean and sanitize in one step, and that's fine as well. If you're looking for those products, do read the label. So there's one of two criteria that you would look for on the label. Sorry, two criteria you would actually look for on the label. One is something called a DIN number, which is a drug identification number, or you may see something called an NPN number, which is a natural products number. And then in conjunction with that, you'll also see somewhere, sometimes in very bold print, sometimes in the fine print, some sort of a claim that it will kill 99% of something or other, bacteria, viruses, influenza, salmonella. They list it in a variety of different ways. But essentially what that means, if it's got that DIN or NPN on it, it means that the claim on the label has been verified by Health Canada. And it lets the user know that the product has undergone and passed a review of its formulation, the labeling, and the instructions for use. And that all of that together does render it effective for the claim that they're making. So if they say they're killing 99% of all viruses, but they don't have that drug identification number on it or an NPN number on it, nobody has really verified that that claim is legit, and it's just marketing. So do look for the DIN or the NPN. The natural products number is something that you'll see on, naturally enough, natural products. Quite often you'll see it on alcohol. So for example, if you've got a hand sanitizer around that's got an alcohol content, it will have an NPN number on it because alcohol is a natural product. The drug identification number is for more of a drug or chemical compound that has been formulated to do a specific task. But both of them mean the same thing, that the claim on the label has been verified. So if you don't see that, I wouldn't necessarily believe the claim on the label. It may not be effective. And if you absolutely can't find any sanitizing agents, I haven't been in the grocery store for a while, so I don't know if the stocks are getting, or the shelves are getting restocked better than they were originally. But if you can't find anything, bleach is always an alternative. It's very effective. You can use 1 part bleach to 9 parts water. And I would say that's the maximum concentration of bleach you want to go. You can probably go a lot less. But certainly that's the one that's effective against things like bloodborne spills, for example. It can be hard on certain surfaces, so be very careful what you use it on, and I would use it sparingly because it can be damaging to plastics and vinyl. It can make them crack and break down. If you are going to mix bleach and water and use that as a disinfecting compound, don't add soap to it. We see that in restaurants quite a bit. People try to cut that washing step with the sanitizing step afterwards, because normally we tell them to wash the dishes in soap and water and then put them in a bleach and water solution, and they try to put it all together. But what happens is the soap actually deactivates the disinfecting components of the bleach. So it renders it ineffective. Also, extremely hot water will have a similar effect on the bleach. So tepid water is fine. It doesn't have to be so hot that you're going to scald your skin. Just tepid water and no soap will give you an effective sanitizer there. But really, I would say a lot of the cleaning products, household cleaning products that we get in the grocery store now are just fine. And if absolutely all that fails, dish soap, warm water, and a cloth, and elbow grease. It's that mechanical action of scrubbing with the cloth with soap and water that will remove probably 99% of most pathogens on surfaces anyway. And the bleach or the disinfecting agent just sort of finishes it off. So soap and water and that scrubbing action is highly effective for cleaning surfaces if that's all you've got. So another question that we get often is, are there circumstances where I would need to close my business due to coronavirus? And I'd say the short answer is, certainly in terms of calls from public health, likely not. We would not be ordering businesses closed as a result of that, except for very, very extreme circumstances. I'd say the bigger risk to your business from coronavirus, aside from the economic impact and the lack of customers right now, would be if you see a reduction in staff due to illness that's large enough to prevent you from carrying on your necessary functions in your workplace. And that's where your business continuity plans come in handy. So all parts of business continuity planning would have you identify what are the critical functions that need to be maintained in your workplace, in your business, and what other functions can be paused for a while to enable you to deploy staff if you find yourself extremely short-staffed. Of course, the list of essential businesses could also change. I'm hoping that we're now on the other side of that, where we may actually see a reduction in the list of essential businesses coming soon, but it's not impossible that gets tightened up at some point either if things don't go as planned. So that, of course, would be another option where there could be a forced closure of your business just because it's deemed to be ordered to be closed. And as I mentioned, only in extreme circumstances would public health order a closure, but it's highly unlikely. I've certainly never seen it. What we would be looking for, should we even become aware of an outbreak, is that a business is acting responsibly and doing what is necessary to limit the spread in the workplace. As long as you're cooperative and responsible and not being negligent and ignoring the risk, then we always prefer working constructively with businesses rather than getting into a confrontational stance. So if it's really not possible to maintain physical distancing in the workplace, and there are some scenarios where it's really tough to do, all we can say, this is kind of one of those, it depends, but really do as much as you can. Stagger, start times, so you don't necessarily have clusters of people arriving or leaving at the same time. Think about spacing in the lunchroom or change rooms, moving lockers, remove tables from lunchrooms so people can't sit as closely together, stagger the break times, provide seating outdoors if the weather ever fully warms up, increase ventilation and air exchange indoors as well. And again, I've talked about screening. That's really is key. You want to try and keep the sick people out in the first place. But of course, because there's asymptomatic transmission, it's not the entire solution. PPE is another piece of this puzzle. So if at all possible, and if you're really in, got people working in confined spaces or close proximity rather, providing adequate personal protective equipment such as masks would be extremely useful if you can source them. And again, that's where your occupational health contacts will come in handy. There's been lots in the news about masks, and I know we've kind of flip-flopped on the wearing of non-medical masks, but there is some indication now that they may be helpful. They don't necessarily protect the person who's wearing it, but what it can do is provide a mechanism for capturing those droplets that are coming out of an individual and restricting their circulation towards others. So it's more protective of others than for yourself if you're wearing a non-medical, homemade cloth mask. And then, of course, a number of people are getting impacted through the anxiety and just the disruption of our lives. So supporting your staff and yourself and your family with mental health resources. There's a number of resources available, and the links are here, and I believe they'll be shared afterwards as well. So there's tons out there now. Some appear to be sort of dedicated just to the COVID stressors that we're seeing, but certainly it's exacerbating existing mental health issues as well. And a couple of myths that I've kind of come across that I wanted to sort of address here, and I think we've probably touched on, I think one of these anyways. So exposure, we've talked about what is an exposure and if somebody's a close contact of a case. What I've sort of seen through, conversations with friends and family or on social media is this myth that's floating around that you can get COVID by walking past somebody on the street. It doesn't move quite that quickly. So the guideline we're using in public health is that you need at least about a 15 minutes exposure in close contact with somebody. So again, being in the same household, working in a shared workspace, that sort of thing, before an exposure is sufficient that an infection could proceed from that. Walking past somebody on the street or in the aisle of a grocery store is not going to be sufficient to become infected. Another thing that I've seen, not so much lately, but certainly earlier on, was lots of news photos coming out of other countries, because I don't believe it's happened here in Canada at all, is images of people spraying disinfectants in public spaces. So you'd see them spraying down roads and sidewalks and benches and things like that with a pack on their back of some sort of disinfectant. It's not necessary, and which is why we're not doing it here, because the spread is, again, from person to person, not from objects. Again, from our work in environmental health that the inspectors do, we are well aware that every object out there is covered in bacteria or viruses all the time. You know, there's bird poop, there's animal poop, there's dust and dirt blowing all over the place. And we don't get sick from that. You know, you don't get sick unless you ingest them. And again, the usual way of not ingesting them is to wash your hands before you touch your mouth or you handle food. So that spraying, some places they have a bit of a cultural expectation where they want to see that something is being done, and this is a very visible thing that they can do, but it's really not effective, and it's not necessary. The other thing that I've heard from a lot of friends and relatives is the urge to strip off when you get home from grocery shopping, for example, you know, at the front door, and, like, you know, bag your clothes, get them into the washer and dryer, and then go straight to the shower. And again, it's not really necessary. You know, healthcare workers, sure, because they're you know, working in an environment where there's a high concentration of ill people for their entire shift, and they should actually be showering and changing at work. But for the average individual, you're not going to be getting that exposed to things. Again, the virus is transmitted by breath, not by objects. So your shoes or clothing won't be a source of contamination. You know, even, you know, the mail coming in, my sister-in-law, she quarantines her mail for a week before she'll touch it. But again, good hand washing regularly after handling something like that is sufficient. So I just wanted to kind of touch on a few of those. And just as we're wrapping up here, did want to let you know that this is a link to something we refer to as the dashboard of public health. It's on the Region of Waterloo's website for public health. And it gives a snapshot, it's updated daily, of the status of COVID-19 in the region of Waterloo. It's a snapshot of the positive cases, trending over time. Now, the graph that you're seeing on there, I think, was created last week, so it's not quite up to date, but the website, if you follow that link, is updated. I think it's at 10:30 every morning with the stats from the day before. So what we are seeing now in Waterloo is really almost two different outbreak curves, and I don't think it's represented on this website yet. I think our epidemiologists are still trying to figure out how to separate the data so that they can actually display it in a graphic form that makes sense to people and is accurate. But we're seeing two different outbreak curves, and essentially one is the community curve, which seems to be slowing down and stabilizing, whereas we're still seeing a lot of cases being identified in long-term care or retirement homes. And that's for a variety of reasons, including the fact that there is a push on by the provincial government to test everybody in those homes. So it's one of those cases where if you go looking for it, you're going to find it. So that's why a lot of those numbers are being driven. But by having that information, we can then better help the homes manage those people that may actually be having some asymptomatic or pre-symptomatic viral shedding, and help them manage their infection control in those homes proactively, because the people are so very vulnerable and they're so enclosed in there. There's a whole host of reasons why it spreads really rapidly. Any organism, influenza is another one that we watch quite closely every winter in homes like that, because it does spread like wildfire once it gets into those homes, because the people are so have so many underlying health issues. So in summary, though, although the community curve seems to be slowing, I'd say we're not out of the woods yet. And when the reopening does come, it will be gradual, as we heard the Premier mention yesterday. So it's likely to be sooner for the community than for those residential facilities, unfortunately, because of their frailty and communal nature of their buildings. And I am very hopeful that within a very short period of time, we will start to see some easing. But it's got to be done in a responsible and graduated manner and not rush, or else we're just going to wind up right back where we are. So I think that's really about it. We've been successful, I think, in terms of managing this. The inconvenience and the cost for everybody really hasn't been wasted. And locally, our hospitals were able to cope with the cases that they had to treat, and they did not become overwhelmed, which was really one of the larger goals. We didn't want to crash the healthcare system. We've come nowhere close to our worst case scenarios, which was the whole purpose of the lockdown as well. So although it's going to be a long time if we get back to normal at all, we can't let the guard down yet. So thank you very much for sitting through that, and I'm certainly happy to answer questions if I can. And I think Allison, you were gathering some questions for me.
Yes, so thank you, Sandy, for that presentation, and we do have a number of questions, so we'll try and get through as many as we can. The first one is, what do you do if an employee is exposed to somebody who didn't quarantine for 14 days after arriving from Europe?
I'm not quite sure what the gist of the question is, if it's about the person that didn't quarantine, which is a whole other question, and that's something that the police are tasked with trying to enforce, although it's been challenging because we're not getting a lot of information from the province about who those people should be and what follow-up is required. But similarly to everything else, it really doesn't matter if they were exposed to somebody who didn't quarantine because they were out of the country or somebody who just went grocery shopping and picked it up. You don't know who's got it and who doesn't. So the management is really the same. If somebody thinks they've been exposed to somebody that may have it, they self-monitor. They keep doing that check-in. Do I have symptoms? Do I have symptoms? How do I feel today? And staying home if anything seems to be amiss. There's really not much more that they can do for that. If they're a very close contact and somebody is definitely diagnosed as a case, then public health would likely be in touch once we do something called case and contact management, where somebody who does test positive for COVID, and we are aware of it, and all the positive tests are reported to public health, so we are aware of those. A public health nurse actually phones that case and then finds out from them who they were in close contact with. So, and again, using some of the criteria, such as, that minimum 15 minutes, or do you live in the same household, the public health nurse would be in touch with those close contacts as well and recommending testing. So if you don't get a phone call from somebody in public health, then consider it no news is good news.
Okay, great. Another question, if an employee has symptoms or tests positive for COVID-19, what can and can't you communicate to warn the work group or the area? What if the outbreak is wider within the company? What can you communicate?
Again, it comes back to the personal health information. I mean, if a person has disclosed to you that they have tested positive, the first thing you could do is ask them, are you okay if we share this information? And you have to respect whatever their answer is. If they say no, then the answer is no, and you can't share that. If they say yes, some workplaces are fairly close and they share a lot of information, so it's okay, and they're comfortable with those conversations happening. But not everybody is. And there can be a degree of vigilantism that's going on out there as well. So don't be surprised if people are a little reluctant to have that kind of information shared. But again, it comes back to making sure you've got those processes and precautions put in place at all times. Don't wait for the diagnosis, just assume it's already there. You could enhance cleaning if you don't think it's already sort of up to snuff. And I think one thing I did forget to mention was that if you do have a cleaning service or company coming into your offices, your facility to do the routine cleaning, take a close look at what they're doing. What are they cleaning? How frequently are they cleaning the high touch surfaces, which would be the desks and the tables and the light switches and the doorknobs? What products are they using? Are they using products that have got the DIN or the NPN number on it? Are they using it according to the label and the manufacturer's instructions? Oftentimes they require dilution. And again, I would see this when I was inspecting a lot. It may say, use a certain amount of this product to a certain amount of water, and what the cleaning staff were actually doing was just kind of eyeballing it and throwing in a little bit and saying, yeah, that's enough. I don't want to waste it. so possibly rendering it ineffective. So have a closer look at what your cleaning policies and procedures are, and are the cleaners actually doing what it is they should be doing or what you think they're doing. And again, that will go a long way, regardless of whether you know somebody is symptomatic or tested positive or not, because the germs are there.
Okay, great. If a staff member stays home because they're not feeling well, so say they have a sore throat, and then they feel better a day or so later, can they return to work, or do they need to self-isolate for 14 days?
I direct you back to our website for that. There are some scenarios on there. And again, if you've got any occupational health and safety advisors, that's the conversation for them to have with them. What's the status? And again, those OC health people should be up to speed on what those restrictions are. And I'm just hesitant to comment definitively because they do change. And I don't get involved in that side of things, but I know there is guidance on our website which talks to it. Generally, what I've read is that if you've got symptoms, you stay home for the 14 days. The fever is a key part of that. If they ever had a fever, it's got to be gone for sure, and they've got to definitely be recovering. But I know I had one of our inspectors a couple of weeks ago. He had a cough, and he was off for 14 days. We were able to let him work from home. We had work that he could do from home, but he couldn't come in for 14 days based on our occupational health and safety guidance.
Okay, great, thanks. Another question, physical distancing, if you are not able to provide individual work trucks for each employee who are required to drive for work, so it's essential work, is there anything stopping the employer from requiring 2 employees in one work truck if they provide PPE, mask, cleaning supplies, proper safety protocols, and they stress the 2-meter distance wherever possible?
Yeah, again, this is where we don't have a lot of experience in some of those workplace scenarios, but my thought is turning towards seeing what the Ministry of Labor has to say about that. And again, they should have resources on their websites, or your advisor can give you some direction on that. But it sounds like, if you're taking all the steps in terms of providing PPE, that should certainly help mitigate a lot of those risks. Keeping the windows open as well, again, getting more airflow and ventilation through the cab of the truck if the weather is warm enough certainly helps. Or is it possible that maybe one worker could drive to a work site in their personal vehicle and then meet up at the work site? So it depends on a lot of different scenarios, but we in public health are not going out and policing that sort of thing. Ministry of Labor inspectors, maybe. So I will say that, we certainly at the early days of this, we got a lot of complaints about workplaces, not necessarily doing what the employees thought they should have been doing, whether or not they were actually in violation of anything or not. I couldn't say, but we were directing a lot of those complaints to the Ministry of Labor, and I know that they have stepped up their inspectors and their resources for that. So that's going to be one of your first places to go to see what their advice is for certain scenarios.
Okay. One last question. We've seen some local companies in the news because they have employees with positive COVID cases. And is there any specific reason why those companies were in the news? Is that information that was released by public health or from the companies themselves?
Yeah, public health would never be going to the news with information like that. The only time we would ever publicize something is if we thought that there was really a genuine health hazard that would impact the public, that would protect the public if they heard about it in the news. So normally, whenever we do become aware of something that we think may be a risk to a certain group of people, we work behind the scenes. Right, going to the media is generally a last resort, not something that we would do lightly. Now what's happening, these days is Dr. Wong is doing those media scrums Monday, Wednesday, and Friday, with where local media is able to ask her questions directly. So a lot of times things are getting picked up because the media has heard of it from other sources, and then asking her on those media scrums, and that's how it kind of gets a little more publicized.
Okay, great. So those are all the questions that we have for today. Sandy, I want to thank you so much for being with us, for sharing your time and your expertise to help our business community through this difficult time. To our attendees, as I mentioned, you will be receiving a follow-up email that has a link to the recording for this webinar that you can use for reference. And I'd like you to also check out our website, as we have a number of upcoming webinars coming up. And again, I would like to thank everybody for joining us today. Thank you.
Thank you so much. I really enjoyed it. I'm glad I could help.
Thank you.